Okay, good afternoon, everyone.
Good afternoon, ma'am.
Okay, at the start of the class, I would like to thank Pradipta, Mayuri, Samapti, and Payal Paul for putting up a good show. I thank you for the video that you sent, and we will all watch this video today, and you can make observations.
Thank you, ma'am.
Okay, so after we watch the video, we will discuss the points, okay, in the given case study. We will have a discussion, okay, as I mentioned last week. Okay, the reflections. What have I learned from the story? And depending on the, how much time we have, maybe one or two of you can discuss. How can I apply this knowledge in my future practice as a doctor? What are the medical, legal, socio-cultural, and ethical issues in this case? And what skills do I need to handle such a case? So for now, let us all watch this video. Is it audible? Visible?
Yes, ma'am.
Okay.
Yes, ma'am.
Next patient. Sit. Name? Surendra Patel. Age? 54 years. Okay, what is he yours? He is my husband. Okay, what does he do? He is businessman.
खाकरा, थेपला, ढोकला, फाफड़ा सब बेचते हैं.
Okay, what's your problem?
I'm having chest pain for so many days.
What kind of chest pain?
It feels like a big elephant is sitting in my chest, doctor.
Okay, any other history? Ma'am, he is diabetic. Any family history? His brother and father has heart problems. Okay, I'm giving some preliminary test. Get it done, then we'll proceed. Okay, thank you now, doctor. Good morning. Good morning, doctor. Okay, let's see. Take a deep breath. Again. Okay, how are you feeling today?
Better.
Okay.
Doctor, these are the reports of the test that you seek to perform.
Okay, let's see. Okay, Mr. Patel, you have unstable angina. You will require an angiogram. You may also require either a stent or coronary bypass after the procedure. The nurse will provide you with the necessary paperwork. Please sign it. And I will plan the procedure for 5 a.m. tomorrow morning. Okay?
Angiogram? Is it necessary to do?
Actually, doctor, I'm not comfortable with this option.
Actually, his brother died during the procedure.
Hey, Mr. Patel, your brother would have had done it with someone else. I have the best hands in town. Nothing will happen when I do it.
But still, I'm scared of it. Aren't there any other option?
Actually, I read somewhere that we can perform CT angiogram.
Are you the doctor or am I the doctor? If you are ready to do as I say so, sign the papers and I'll see you tomorrow at the cath lab. Otherwise, you are free to get discharged tomorrow. Next patient. Sit here. What's your name?
Surendra Patel.
Age?
54 years.
How are you related to him?
He is my husband.
What do you do as an occupation?
He is a businessman.
So, what is your problem?
I'm having chest pain for so many days.
What type of chest pain? How does it feel?
It feels like a big elephant is sitting in my chest.
How long have you been suffering from this?
Almost 1 month.
Does he have any other problem?
Yeah, ma'am, he is diabetic.
Any family history?
Yeah, his brother and father has heart problems.
Okay. So I'm giving this some preliminary test. Please do this and then we will proceed later.
Okay. Thank you.
Good morning.
Good morning, doctor.
How are you feeling now?
I'm better.
Take deep breaths.
Doctor, these are the reports of the test that you said to perform.
Okay, so Mr. Patel, you have unstable angina. So you will be needing an angiogram. And after that, you might need a stent or a coronary bypass after the procedure. So the nurse will provide you with the required paper. So if you agree, then please sign it. And then I will schedule the procedure for 5 a.m. tomorrow.
Angiography isn't necessary to perform.
It is.
Actually, doctor, I'm not comfortable with this option.
Actually, doctor, his brother during performing this procedure died.
Don't worry, Mr. Patel. You are in very good hands. We will take absolutely good care of you and we will try our best here.
But still, I'm scared. Are not there any other option?
Actually, doctor, I read somewhere that CT angiogram can be performed.
Actually, madam, for his case, no, it is angiogram that will be the best course to do over here.
But still, I'm scared. Can we take another second opinion?
Well, if you persist on taking a second opinion, then yes, we're not sure. I'm referring you to Dr. Shetty. He's a very good cardiologist. Here.
Thank you, doctor.
Thank you, doctor.
So now let us have your comments. Okay, roll numbers 1 to 12. Anybody from roll number 1 to 12? Yes, what have I learned from this story? Yes, anyone? Aaron is there? Aaron?
Yes, ma'am.
Yes. What have you learned from this story?
Ma'am, in the story, the doctor was arrogant. He wasn't listening to the patient's words. Like he had pride in himself. He didn't care about patient autonomy, and that's all.
Okay. So the arrogance on the part of the doctor. Okay, so as doctors, we should always act in the patient's best interest. We should think, what is best for the patient and look at the situation from the patient's perspective, isn't it? So anybody else from this group? Roll number 1 to 12. Ayang Siram is there? Ayang Siram? Briga Marak? Briga Marak?
Yes, ma'am. Yes, ma'am.
What have you learned from this story?
As like Aaron has said, like the doctor has too much pride, and plus, as we have read in the story that doctor is pressurizing the patient. Like he's not clearly giving him the option to choose. Like the patient he is asking like, is there any other test? But he's not giving him this one because he has like too much pride in his work. Like pride in work is good, but too much pride will also lead to ignorance, and because of that ignorance, the doctor which is currently like treating the patient, he might get by like beaten up as like in current situation, like he might get beaten up by the patient's party also, like as we know the current situation which is going on. So that's my opinion, ma'am.
Okay, thank you so much.
Yes.
So this dialogue between the patient and the doctor is very important. And I was happy to see that in the video, you have kept the patient is accompanied. Actually, in the story, it's not mentioned whether the patient had an attendant or not. Okay. So had Mr. Surendra Patel been alone, all by himself, no social support, nobody there for him, it would have been, much worse. But thankfully, in the video, you have thought about it. His wife was there, by his side, assisting him, helping him arrive at a decision. See, this is all part of shared decision making, isn't it? Your family members, other, people who care about you, they can help you. They can help the patient make a decision. And that dialogue between the doctor and the patient is very important. Okay. Now, what is the extent of patient autonomy? Can we always give patient autonomy to do whatever they wish? Yes or no? Are there limits to patient autonomy? Is the answer yes or no? Are there limits to patient autonomy? Yes.
Yes, ma'am.
Okay, depending on the situation. Because, okay, we should think from the patient's perspective. We should give the patient freedom to decide after understanding whatever we have told the patient. But at the same time, we cannot give the patient too much freedom, because sometimes what the patient decides may not be in the patient's best interest. Okay, may not be good for him or her. Okay, so we should strike a balance, okay, between empathy, having compassion for the patient, understanding things from a patient's perspective. But also we should have that authority. At the same time, we should have the authority. Okay, the patient has come to you seeking help. So we should act in the patient's best interest and guide the patient to make the right decision. Not force, but guide the patient to make the right decision. Okay, and for that also, I have noticed that in the video you have incorporated communication skills. Okay, which is very, very important. There was that case of the rude doctor who just didn't know how to communicate. Okay, and the latter part, the case of the, understanding doctor who knows, how to communicate with the patient. So communication skills are vital when you talk to the patient, making them understand. Okay, and also we have to know that there are boundaries in the doctor-patient relationship. We cannot always allow the patient to do whatever they like, and we cannot become too personal with the patient. Okay, true, we have empathy, we have compassion, but we cannot get too personal with the patient. Okay, that's a limit. And that only, your experience will tell you how much to go, how far to go. Okay, so there are boundaries in the doctor-patient relationship. Okay, let's move on to the next question. How can I apply this knowledge in my future practice as a doctor? So who is going to answer this? Roll number 13 to 25. Yes, anybody? Zisekili Mere is there? Zisekili Mere? Albert, are you there? Am I audible?
Yes, ma'am.
Yes, ma'am.
Yes. Yes,
Okay,
ma'am.
would anybody like to answer this question? How can I apply this knowledge in my future practice as a doctor? Would anybody like to volunteer? Laishram Donal or anybody?
Yes, ma'am.
Yes.
We can apply in how to take care that the patient's autonomy is respected, and patient must know what they are going to do, so that their treatment option they can choose that, and we don't just apply our decision upon them.
Okay, thank you. Anybody else? Anybody else would like to volunteer? How can you apply this knowledge in your future practice as a doctor? Anyone? Okay, let's move on to the next question. What are the medical, legal, socio-cultural and ethical issues in this case? Yes, Pandap Lindra, are you there?
Yes, ma'am.
Yes, would you like to answer this question? What are the medical, legal issues? Or whatever you have written or prepared, you can read that out.
Ma'am, I didn't prepare anything for this class.
Okay, you can just mention whatever you know.
Ma'am, I think the ethical issues in this case is that the paternalism is in play.
Okay. Okay. Anything else? Any socio-cultural issues? Socio-cultural?
I don't have any idea, ma'am.
Okay. Okay, anybody else would like to answer?
About socio-cultural,
Yes?
his family members were had the same problem about heart problem, so he was scared about his, as he has seen his family suffering from the same disease, and his brother died because of angioplasty, so there was some social effect of on him about the disease.
Yes, very true. If we have seen our close friends or family members suffering, then, our experience drives us to think negatively of that particular situation. Just like in the present situation, those who have had a family member die of COVID, or family member suffering from COVID, being admitted in the ICU, undergoing a long period of treatment. So that gives you a negative feeling, negative thoughts about the whole situation. And you think, oh, I'll never be able to come out of it. Okay, so that is patient's perspective. Okay, socio-cultural, something that happens to your family member or to your close friend. That experience affects you in some way or the other. Okay, then medical legal issues. Have you identified any medical legal issues here? What is the dialogue between the patient and the doctor? What is the dialogue between the doctor and the patient? Obtaining informed consent. Okay, obtaining proper informed consent. Okay, so I already mentioned, isn't it, the components of informed consent. You have to tell the patient the diagnosis. Okay, now suppose in this case, okay, the doctor says unstable angina. The person being a lay person, the patient being a lay person may not be able to understand. So the patient has a right to ask the doctor, doctor, I don't understand, medical terminology. Can you tell me what is unstable angina? And it is the duty of the doctor to explain. Okay, there is decreased blood supply to the heart, as a result of which, you're having chest pain and you feel as if an elephant is sitting on your chest. Okay, so in very simple language, simple terms, the doctor can explain to the patient. Okay, the patient has a right to ask the doctor if he doesn't understand certain terminology or certain expressions, certain, medical jargon which you use. Okay, so try to speak in simple language. Okay. Then informed consent is one medical legal issue. Informed refusal. The patient has a right to refuse. Okay, now in this case, suppose the patient wants to refuse the treatment after understanding everything. So the doctor will try his best to convince the patient that this is good for you. Communication and counseling. These are vital. Communicate with the patient and counsel and give the patient a chance, ask again. But in spite of all your efforts, patient still refuses. Then you cannot force the patient. Rather, you should ask the patient to sign a form, the informed refusal form. Okay, it has to be documented. Document the patient's refusal of treatment. Okay, so medical legal issues are informed consent and informed refusal. Okay, socio-cultural, you have already mentioned experience of other family members. Then family support, which we saw so nicely in the video, the wife being there to give support to her husband. Ethical issues, okay, relating to patient autonomy, beneficence, okay, what is good for the patient, autonomy and beneficence. So would anybody else like to say something on these issues? Anybody? Would you like to add your comments? Anyone? Skem Kupar Lingdo, are you there? Skem Kupar. Tanvi Marak, are you there? Yes, anybody would like to add anything else? Am I audible?
Yes, ma'am.
Okay, would anybody like to add anything else?
Yes, ma'am. In ethical issues, we can say that the root doctor who is there regarding the means he has no empathy towards the patient.
Yes. So lack of empathy, right? Okay, so that is also an ethical issue. Lack of empathy, lack of compassion and empathy for the patient. Okay, very good.
Yeah, ma'am.
Anything else? Anything else? Anybody?
Very arrogant and very much confidence.
Overconfidence and arrogance.
Yeah.
Yes. So the doctor may be, an MCH, MD, MCH, you have all your qualifications and all your skills. But then, if you have too much pride, as one of your classmates mentioned, it can spoil your career. Because then, not only will you be beaten up by the patient's relatives, as is happening now, but it can erode, it can destroy the doctor-patient relationship. Okay? So, too much pride will not help anybody, least of all a doctor. Anything else? Paternalism, as some of you mentioned. Yes. Excessive paternalism. That means always expecting the patient to do as he or she wants. Okay, a doctor thinks he is always right. Doctor thinks he is always right. And patient should do as I instruct, as I want him to do. So that is excessive paternalism. Okay. Okay, what about the fourth question? What skills do I need to handle such a case? Would anybody like to answer this? What skills do I need to handle such a case? Some have already been, thrown into light. What skills? One skill has been demonstrated very nicely in the video. What is that?
Communication skill.
Communication skill, yes, very good.
Communication.
Yes. So anybody else would like to answer? Yes, Sanjeev, are you there?
Yes, ma'am.
Yes. So what skills do you think you need to handle?
First of all, I think, ma'am, that a doctor should have the good communication skills And then doctor should also be empathic, and he should have all the ethics and good knowledge of ethics, and his attitude towards the patient should be appropriate. And I think that's it, ma'am.
Okay, thank you very much. Thank you, very good. So anybody else? Anybody else would like to add any comments? Anybody else? Okay, if there are no other comments, then just like the previous case, you can write a narrative. Okay, this will be your assignment. So most probably your offline classes will be starting, but you can send a Google form just like last week. Okay, you can write it on a Google form. It will be easier for you because I'll be storing all your answers, because right now you don't have your logbooks with you. So I think it is better if you send me in the Google form before next Friday. Okay, just like you did for the previous assignment. Okay, write a narrative based on the reflections in the case study in about 200 words. Submit via Google form, which will be sent via a link in the WhatsApp group. Okay, and just remember these guidelines for writing a narrative. It has a beginning, that is an introduction, a middle, that is the main story or the body, and a conclusion or an end. Okay, so this is a guideline for writing the narrative. It has a beginning, an introduction, a middle, the main story, and an end, that is the conclusion. Okay, and please try to submit before next Friday so that I can go through it and we can have a discussion on Friday in the next class. Okay, and I'll be, saving and storing all your answers so that it will be easy for you when you have to submit your logbook, because the answers are already there, stored in the computer. It will be easier for you as well as for me. Okay, and I would have already evaluated them. So as and when you get your logbooks, your physical logbooks, you can fill it, anytime. Okay, but I will be evaluating beforehand so that it's easier for me as well as for you. Okay, because if we leave everything till the last minute, then things will get very cumbersome. Okay, so so I trust that you will do this assignment and submit it before next Friday. Okay, please pass on the message to your classmates who are not present in this class. Okay, is it clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so that's all for today. Thank you very much. Thank you very much.
Thank you,
and
ma'am.
once again, congratulations,
Thank you, ma'am.
the four performers. The four performers,
Thank you, ma'am.
you did a good job. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you.